Welcome to the Postpartum Performance Podcast. If you're here to be empowered and encouraged, you're in the right place. I believe every woman deserves to learn who's in her corner, which is why this podcast was created, to share encouragement and intentional conversations around women's health, nutrition, and wellness for new mothers. In each episode, we will discuss ways for women to find truth for her health, to feel strong, and to be confident from the inside out. I'm your host, Dr. Lindsay Peczkowski, a performance physical therapist with a passion for teaching others about pelvic health and guiding mothers to build movement, confidence, and strength. I'm a lover of running and weightlifting and a healthy cooking enthusiast. All right, ladies, grab your coffee and settle in for an episode of the Postpartum Performance Podcast. Are you with me? Here we go. Welcome back to the Postpartum Performance Podcast. Today on the show, we have Dr Burelson, and she is going to be sharing a lot about her experience as a PT, but also as a CrossFitter. And also she has some exciting news to share with us on how that's transitioned for her in the past couple of months. So welcome to the show, Ariel.
Thanks. Thanks for having me.
Awesome. So I would love for you to share a little bit about yourself, kind of what your background is as a PT, but then also more on like the fitness side of things. What's your story? And kind of just go from there to give the listeners a little bit more about you.
Yeah. So as you said, I'm Dr Burelson. I received my undergrad degree up in Mars Hill University. Nobody's probably heard of that, but it's in North Carolina in the mountains. And there I got my athletic training degree, and I also played soccer there. So that was awesome to get that experience. And then I got my doctorate at Wingate University, again, a small little town in Charlotte, North Carolina. But then from there, I started working with Andrew ever since at the Charlotte Athlete. It's a physical therapy clinic, but it's very, very unique in the fact that we're actually located inside of a CrossFit gym and treat almost exclusively athletes. So all kinds, whether it's CrossFit, cross country, whatever they want to do, marathons.
Awesome.
So that's an awesome setting for me. And then on the fitness side of things, like what I like to do, as I said, I was a college soccer player, and I knew as soon as I graduated, I needed something to stay active. So I joined CrossFit and never looked back. I love it. And so the fact that I get to combine the CrossFit and physical therapy side of things like together, it's awesome to me. So it's exciting.
That's wonderful. That's a very cool blend to be in, because we met Andrew through the business group that we're in. And he just it's really cool seeing the model that he has in the CrossFit gym setting. And we had similarly started in a CrossFit gym and now have a different space, but having that bridge between kind of traditional physical therapy and then more of the active individuals, which is so, so fun. Especially being like a former and current athlete yourself, it definitely, I think, makes work a little bit more fun. Yeah. Awesome. So we'll just dive into some of the other questions and things. So in general, we're going to be focusing today on CrossFit and fitness, but also fitness during pregnancy. Because Ariel has some exciting news. Go ahead. I'll let you share.
So I'm 4.5 months, or I guess 18 weeks pregnant now with my first little baby. So that's been a huge transition. I know it's exciting, but it's been a huge transition because, like I said, I'm a pretty competitive CrossFitter. I've been competing for 5 years. So to have to dial it back is a little mentally challenging, but it's been good. It's been unique so far, but it's been fun.
Awesome. And I think I'm excited for this conversation because there's so many women, when they become pregnant, they don't really know what to do because there's guidelines out there, but it's a lot of see how you feel, see how you respond. And that's so difficult as you're trying to train, stay active. And especially during that first trimester, most people aren't feeling too awesome, but trying to still be consistent. So I would love to hear kind of your journey so far in how you've been either modifying your workouts or what your game plan has been and what's been the biggest challenge.
Yeah. So I fall in that group of people that when I found out I was pregnant, I was like, what do I do? Like, it was exciting, obviously, like we were expecting it, but I wanted to stay competing in CrossFit. And I actually, like 4 weeks after I found out I was pregnant, I had a competition planned. And then actually this past weekend, I had a competition. So I still like to compete. So finding that balance was definitely challenging for me. So that was the first question that I asked my doctor. And he was just a little more old school. And the only advice he gave me, like, I don't even know if he really knew what CrossFit was, to be honest, but he was just like, yeah, just keep your heart rate below 140. And I was like, okay. Like, that wasn't a very good guideline for me because I'm used to pushing like pretty hard. And I feel like my body's adapted to a pretty high heart rate without any problems associated with it. So I was like, oh, okay. So thankfully, with my background in physical therapy and like being active and all that, all that fun stuff, I know a little bit about the human body, I like to think. So I know. So I also did my own research. There's a lot of controversy on whether you should do core work, like whether you should do planks or sit-ups, or if you should do any kind of kipping in CrossFit, or if you should wear a belt while you lift, and about the heart rate. And so I dove into all that, and actually Andrew wanted me to write a blog on all of this. So I did. I wrote a couple blogs, and I'm going to continue writing them throughout my pregnancy to help other people too. But I found that the heart rate thing is a little bogus. I'm not trying to like redline it by any means, but I still push pretty darn hard. Because in my mind, I've been doing this for 5 years now. And so for me to like suddenly take it easy and almost like decondition myself while I'm pregnant, I feel like that would be more detrimental than continuing my fitness level. Obviously being safe, but yeah, I feel like I should continue what I'm doing because my body's used to it. So I don't necessarily follow the heart rate thing. Again, if I need to breathe, I'll breathe. I'm good at that anyways in the WOD or in the workouts. But first trimester, I actually didn't have to modify anything. And I actually felt really good the whole time, knock on wood.
That's great.
Yeah. Things like that. Yeah. Everybody that I've talked to said the first trimester is the hardest, with sickness and just not feeling that great. I will say I was tired, but I feel like I'm always tired with everything that we have going on in our life. So I was like, nothing's new. But there was a week that I felt a little nauseous, but again, I was okay. And that went away, and I continued to work out every single day. And, usually about an hour at a time, sometimes a little more, but all that was good. And then I guess I'm like halfway through my second trimester now, something like that, a couple weeks into my second trimester. But as soon as my second trimester hit, that's when I had to start modifying things, not because of like pain or anything for me. But again, I just know about the human body. And so with all pregnant women, you experience like stretching of your abs to accommodate the growing belly and the growing baby. So I know that if I keep doing like sit-ups and like things that deliberately like stress my core, like the kipping, that it could worsen that stretching and make my recovery longer. So as soon as I think the first instance was on like rowing, actually. If I would lean back too far on the row, or also that same day I tried toes to bar. If I did, like as I was coming down from toes to bar, I noticed like coning of my abs. So I was like, oh crap, like I don't want to experience that. So I just backed it off, and I haven't done those since. So I haven't done any kind of kipping anymore. I will do like strict pull-ups still because I feel like I can control my core. I haven't done any kind of sit-ups. If my gym prescribes that, then I'll just do a plank, which again, that's a controversial topic too with pregnancy. But again, I watch my stomach the entire time. And if I see coning, then I'll take a break. And if I need to, I'll elevate it to like a box or something, still being safe and still watching my body and how it responds. But I know that was a lot of info, but that's generally what's going on now.
Yeah. And I think that's so great because for listeners, as you can hear Ariel talking through kind of what she's been doing, she's been very active since before she was pregnant. Like she had said, she had been doing a lot of CrossFit stuff for like a long time. So for her and her body and what her training has been, she's able to continue to train in modified ways into that and some of that intensity, or modifying that intensity, where sometimes women will find out that they're pregnant and they're like, I need to get in this exercise routine right now. And they might not have really been doing much for exercise. So keeping that in mind with your situation, that for Ariel, she is very active. And so she's, of course, like she said, not going to decondition herself because you're training for birth, like you're training for motherhood. And it's not that like, yes, pregnancy is part of it, but then also like the actual labor, delivery, and then postpartum, you want to be in the best like shape in a way that you can be like in a safe way. So keeping that in mind, like exercise is so good during pregnancy because it has so many benefits, but being mindful of that as you're, going through stuff. If you're like, yeah, I've never done this activity or this sport before, maybe that might not be the best time to be like, I'm going to start CrossFit, if you've never done any of that stuff.
I fully agree. Yes.
If you're familiar with it, then go for it. And, and talking to the coaches, I'm sure there's plenty of other members at your gym that have had kids and just hearing kind of their experience too. Cause I think being around other people and other women that have had kids or have gone through pregnancy and things like that can be so much more information because they, like you were saying, you weren't sure if your doctor really knew much about what CrossFit was. So other people that have been through it and saying like, oh, like, what did you do? And everyone's different too. So someone else might modify things sooner or later or take out certain exercises and absolutely.
Yeah, that's been a tremendous help for me because I don't know what it is about my gym, but I guess it's like a baby boom right now. But there was like 3 or 4 babies born within like the last, or actually I should say 4, within like the last 6 months to a year. So I got to kind of like watch all those women kind of go through all of this. And then now that they've had the baby, I'm like, okay, did you feel this? And because one of the other things that I stopped doing is running because that one actually was uncomfortable for me. And I actually stopped that pretty early. I think that was like right at the first beginning of my second trimester. But I started to feel it was like a really long workout that I'm used to again, but it was like 2.5 miles of running inside of a workout. And like 2 miles in, I started to feel like stretching in my lower abdomen. And I was like, this doesn't feel right. So I kind of just stopped, and apparently it's your uterus stretching, which I guess that's normal. So, and then I talked to all my friends in the gym that have experienced it, and they're like, yeah, we got that too, but they got it a little bit later. So like you said, everybody's different. Mine just happened to be a lot sooner than theirs, but
and vice versa.
So I just listened to my body, and I've been biking since then. I haven't ran. So again, just listening to your body is the best thing to do.
That's awesome. And for you, for any, like the exercise modifications that you're doing, is there anything moving forward besides modifications or things that you're going to want to add into your workouts? Because for my specialty, working like women's health and different things, we do like labor prep sessions, usually in that 3rd trimester, and kind of talking through positions or different exercises and things. But are there any things that you've come across that you're like, oh, I want to start doing this to prepare, or anything like that you're kind of shifting in your training? If you're not doing a CrossFit workout, like what other stuff are you doing for activity?
I have to say I'm not doing a whole lot, but I have thought about it. It has crossed my mind because I've actually, when I found out I was pregnant, I started following more like pelvic floor therapists and like women's health therapists. And again, I'm like new to this whole thing too. And of course we learn about pelvic health and all that in school. But again, I've been in like the sports realm that we don't really deal a whole lot with that. So if you don't use it, you lose it. So I have like a brief understanding, but I even, like I was mentioning to my husband, like I wouldn't mind reaching out to like a pelvic floor specialist and just seeing what they have to say, because I do know I don't want to be one of the women that are in my gym that can't jump rope anymore without peeing themselves.
Absolutely.
So I'm like, I definitely want to get a kickstart on that. But I have not made steps toward that yet.
And there's, so much that like different reading things and looking into stuff, but finding that pelvic health therapist. And disclaimer for so many women, as a pelvic health therapist, see someone before you have your kid. Like you were saying, you're going to look for someone, see someone before you have your kid, because it's helpful for you to get insight on what you can be doing leading into that. And if there's other things going on, but then also it's helping the therapist prepare a better plan for you, that they've seen you beforehand, and then they can hear about how labor and delivery was and gather that information. And then they see you postpartum, and then they're checking things that it can help kind of bring those puzzle pieces together. So a lot of times people are like, oh, I should see them after the fact, which Yes, go see someone after too, just to kind of clear things and just make sure things are smooth sailing or working on the things that you need to. But that beforehand is really important too, because then you've already also built that relationship with them. And if stuff comes up, a lot of the pelvic health therapists are so open to like giving you more information when things come about, that you can reach out and be like, hey, this happened. What do I do? And like whatever that is, and building that tribe. For sure.
I agree. I definitely agree.
That's awesome. So for thinking about, so we've talked a little bit about kind of like the physical side of things. We know fitness, exercise, all of that during pregnancy is great, modifying as we need to, everything like that, because it's really helping. Research has shown that it helps reduce chance of a cesarean. It reduces usually labor time and just like so much more with how your body's shifting and adapting. But what have you been doing, or what's something that you've started to do for more of a mindset thing during your pregnancy as an athlete, whether that's day-to-day stuff that you've noticed you've had to shift, or even as a practitioner or as an athlete?
So I will say it's had the biggest effect on me as an athlete. Mentally, it has been very challenging for me. I think I've actually, within like the last week or so, I've gotten a lot better with it. But as I mentioned, I'm super, like I've been competing forever and I like to win. So, and my husband does CrossFit with me and we're very competitive toward each other, and I'm used to winning. So now that I can't win, it's hard. But again, I just keep thinking of the bigger picture and knowing that obviously my body's going through a lot. And then aside from like the winning perspective, I also like your body's going through a lot. So I'm not used to my body looking like this. And again, I just keep reminding myself like I'm growing a human and everybody else keeps reminding me that too. So it's very helpful. But like I mentioned, I had a competition this past weekend that was pre-planned and it was supposed to be 2 months ago, but COVID kind of screwed that up. So 2 months ago, I wouldn't have had to modify anything. But my competition was this weekend and it was a 4-person team. So, and we knew the first 3 workouts going into it. So I knew that I could do all of that stuff without having to modify. So I was like, okay, well, I can still do it. And then the next workout that got announced was all kinds of stuff that I couldn't do, like bar muscle ups and chest to bar pull ups. And so my team was actually super, super awesome. And I ended up doing ring rows, which obviously didn't count in the competition and we got eliminated, but they stood by me and supported me because they knew obviously what I was going through. And so it was really awesome to have their support. So I would say as long as you have a good support, like my husband's been great. Everybody at the gym's been great. So yeah, the support system for me has helped me tremendously get through it mentally. And like I said, I think I'm over that little hill now, but prior to I had like maybe 1 or 2 breakdowns, but I'm over that now. So
that's good. Well, it's such a transition. Like you were saying, you have to look at the big picture where like, in the trenches, you're like, oh my gosh, this sucks. I have to change this. I'm not able to, push myself or be as competitive. But that's awesome too, that your CrossFit gym and culture there is supporting that, because not all places can be supportive to that or like actually allowing you to modify those things and not make you feel like you should or shouldn't be participating or whatever those things are. So that's wonderful.
Because it was even hard too, which a couple of weeks ago, which is why it was even harder for me, is because I'm at that awkward stage where I'm not like really showing that I'm pregnant, but I'm like obviously gaining weight. So people are like, are you? So I'm like, I know I can like physically do those movements in the gym, but I know I shouldn't. So that's where it's like hard, like playing in your head, like what you should and shouldn't do. But if I have any hesitation about anything, then I'm just like, obviously I shouldn't do it. So I'm just not going to. So I just always play it safe, and it's been going good since. So
that's awesome. Yeah. And I think that's a big thing that so many women through their pregnancy are learning so much about themselves. Like whether that's like, yes, I agree with this, or there's just so much more like information out there, and then really discerning, like, does this fit for my situation, for where I'm at, what I'm doing, and like taking it all in, but then also kind of getting rid of the stuff that you're like, nope, that's not really for me. Nope, not that for me either. That's great. How has nutrition shifted at all for you during kind of your pregnancy so far? If you've noticed any changes, I know there's sometimes cravings for people or just different things depending on, or any stuff that you've been like really into on like the food side of things for you.
So I actually haven't had any cravings, which I guess is a good thing because I don't want to gain like a ton of weight. My mom gained 60 pounds. So that's like in the back of my mind, like that's not normal. But they say average is 25 to 35, which I'm okay with that. But like I said, my mom's in the back of my mind. So, but I'm like, because I've never been super strict about my diet anyways. Like I eat relatively clean, like we meal prep, but if I want some ice cream, I'm going to eat some ice cream. So I'm not super strict. I do try to eat relatively clean throughout the week. And then on the weekends, I'll just eat whatever kind of thing. So I'm still staying consistent with that. We still meal prep every week. That's pretty much it. The beginning, like the first trimester for some, like that week that I was talking about that I felt nauseous, the weirdest thing, it was slaw that I could not like hear that word or like think about it. Or like I said, I never got sick, but I was just like, I cannot even think about that, which is the weirdest thing. Like normally people are like chicken and like, I don't know, normal foods that you don't like, but it was like slaw for me of all things. I don't know, but still to this day, I don't really care for that, but
you're like, maybe we'll take that off the menu.
I know it's like the weirdest thing, but since then, I can't think of anything else that I've changed. I don't feel like I'm eating any more than I usually do. I think I have a bigger appetite anyways, but like I like to eat, but I don't think it's changed since being pregnant. So stay pretty steady.
Yeah. Very, very cool. So I want to shift a little bit. So as a PT in the CrossFit setting, I love that. So you're working with so many active individuals, but also active individuals that then have jobs, have other things that they're doing in their day-to-day life. So I'd be curious to hear kind of what are some of the top things that you're seeing in your setting for treatment or like patients that are coming in and what they have going on, and how that kind of in your setting, because of the uniqueness of the setting in the CrossFit gym, how that is for you guys.
Okay. So we see all kinds of stuff, but yes, usually they're really active individuals. It's actually kind of cool. My husband is actually a physical therapist too, and he works in a typical outpatient clinic where he sees like post-surgical, variety of everything. So actually we compare our jobs all the time because they're so different and they're hard for different reasons, because he sees like 3 people at one time whereas I'm only one person each hour. So it's a lot less, but usually a lot more intensive cases for me. Whereas he's seeing a lot of turnover. So it's cool to compare. But as far as what we see here, it depends usually. I mean, we see a lot of like low back stuff going on. We had some neck stuff this morning, but usually it's tough to say. Usually some of the stuff that we see is like what we say is insidious onset. So it's not like they had an acute event usually, like sometimes we do, but usually it's things that have been culminating over years, like whether it's your sleep habits, like the positions that you sleep in, or whether you consistently do a certain thing at work that kind of leads into the presentation that you have now, or your exercise technique that kind of leads to, years and years of doing those repetitive things over time are what's causing your injury and pain right now. So we focus really heavily on finding the underlying cause as to why all that happened, and not necessarily like if you come in with shoulder pain, we're not just going to treat specifically the shoulder. We're going to look at sleep, exercise, work, and make modifications to all that to ensure that it doesn't come back long-term, because our goal is long-term relief. You don't want to have to rely on a practitioner the rest of your life, or like, I don't know, shots, cortisone injections, all that kind of stuff. Like we just, the underlying cause is our biggest focus. So I don't know if we see like, I'm trying to think of the most common injury that we see, but it's hard to say.
It goes in waves of certain things. It seems like, that's similar for us too. Yeah. What's your favorite thing to treat? Like if someone comes in.
Yeah, I think the shoulder. I see a lot of that in CrossFit just because of the style of CrossFit works certain muscles and kind of denies others. So I don't know. It's just funner for me to treat. But I will say, since being pregnant, so if somebody comes in with a shoulder injury, then we're giving them like modifications, like they need to substitute certain things in CrossFit. Well, now being pregnant and not like hanging from the rig anymore, I'm like, oh, well, now I have to implement all the things that I'm telling my patients. So I'm kind of getting a sense of what they go through, having to modify things all the time. So I don't know, it's kind of eye-opening and kind of cool at the same time.
Yeah, absolutely.
We go through that same thing, kind of.
Yeah, for sure. And I love, we're similarly like looking at like the big picture of what's the underlying cause, but also like the other factors. And I think that's what is such a beautiful thing with how the setting that we're working in and how we can really like shift health and shift treatment and plan of care and just like healthy, active lifestyle. Because sometimes we think in these silos of like, well, this is a physical thing. And then it's like, but how is your sleep? How is your nutrition and all of that stuff? And kind of going through, because I'm sure you've had many people where they're like, oh, my sleep is terrible. And they're like, but this also, and this, and my stress and this. And so keeping in mind that there's like so many factors, and even bringing it back to pregnancy as well, it's like, that's another like silo or factor that has to be kind of brought in, of things are shifting and changing quicker than kind of the typical or the norm for someone like the average person. And being able to kind of bring in all of those things. So being mindful of that, for the listeners, if you have something that's going on, to think about other factors besides where you might be experiencing pain, or where things are kind of going on in the physical sense of like, what else could be contributing to this? And then, seeking out someone for that help, because that's what kind of, we're the problem solvers. We're like movement problem solvers, but also kind of that full body health thing as well.
Yeah, you'll unravel so many different aspects of your life that you like didn't have a clue that were contributing, and it's all connected. It's awesome.
Absolutely. So I got two more questions for you. So one thing I love asking guests is, what is I wish I would have known this sooner? Whether that's something that comes up with the athletes that you're working with, or even being first-time pregnancy, either of those, kind of what's something that comes up, whether that's, just whatever is kind of that common thing. Cause I like bringing that up so that if someone hears this and they're like, oh, now I know, and then they don't have to kind of go through that. So whatever that would be for you.
I know, that's a good question. Nothing pops out on the top of my head, but I would say, like, going back to all the like controversial topics about being pregnant and working out, because you better believe me, I still have like my Nana on Facebook saying, you better be careful or don't push too hard. So it's still like, I guess people not knowing that it's still safe to work out if you've been doing it for a long time. Like, I don't know. I just wish people would know that I'm still being safe and I'm not going to push my body harder than I think it can handle. I don't know. I don't know if that answered your question very good.
No, it does. Yeah. Yeah. I think for, like we were saying before, is like doing your research, and making it, seeing if it fits with kind of your situation. Absolutely. I think that's great.
Yeah. And there's just so many people, I guess that's where I was going with that. There's just so many people out there that have their own opinions about what you should and shouldn't do, that I want to make sure that, okay, yeah, I think it's okay, but I want to make sure it's okay. Cause like, right when I found out I was pregnant, or right when we announced it, there was a guy at my gym and he was like, oh, you're not going to be doing that too much longer. And I was just like lifting a barbell, and I'm like, why not? Like, why can't I do that? There's nothing wrong with what I'm doing. So yeah, you just have that doubt in your mind, and you just want to make sure things are okay and you're doing the right thing for you and your baby. So yeah, I guess just busting all those controversial myths and stuff that are out there.
Debunk
something
those
I would have
myths.
known sooner.
Yeah, absolutely. Yeah, absolutely. And like so many things, like even just like your barbell example, like you might have to use a different strategy of like breathing or bracing or like certain things, but it's not saying no, it's saying, okay, let's find maybe a different way. And then there might be at some point that you, like you were saying, like, if I notice this, then I'm going to stop doing that. Then it might be, okay, so I'm going to stop doing this exercise or this movement temporarily, knowing that you can do this in the future, but this this season of time, you're like, I'm choosing not to, because you're thinking long-term. So I think that's great. That's
I know.
awesome.
I'm like, I want my recovery to be as fast as it can be. So I'm not going to do anything that prolongs that.
Yeah, absolutely. So last question I got for you, I ask everyone this one, is what advice would you give to a new mom struggling with trying to kind of find her new routine as a mother or stay healthy? So I guess more from your side of things, if you had a new mom come into the clinic and you're working with them and they're just like overwhelmed, what advice would you give for them?
Don't stress. I've been there. I stressed a little bit. It does nothing for you. I suggest like finding a good network of people. Like for me, like I said, it's with my gym, with people that have already gone through it. So whether you have like a long distance friend or something that's already gone through it, using them as an outlet to like ask questions about anything that you have going on. Cause like I said, I felt like a little bit of weird pain in my like lower abdomen from running, but I asked somebody else what they thought about it and asked my doctor and they're like, no, it's normal. And I'm like, oh, thank God. Cause you never know what your body, like what you feel, if that's normal, cause it's new.
Yeah.
So finding that outlet of people that support you is the number one thing. And then I know everybody says, listen to your body, but that really is the best thing you can do. Like I said, I know that I've been training for a long time in this sport, so I know that it can handle it. And like I said, I'm not redlining each time, but I'm still pushing hard. A quote that I read when I was writing the blog that I wrote about pregnancy, it said, if you had a marathon coming up in like a month or so, you're not just going to go in there cold and not have trained for it. Well, labor and delivery is like the biggest marathon of your life. So why go in there without training for it? So that always stays in the back of my mind. Like I'm going to keep exercising and keep staying fit without like we mentioned earlier, without deconditioning, because I want to make sure I'm fit for that marathon of delivery, because I know it's going to be tough. So again, just listening to your body. If you've been doing it for a long time, it's perfectly normal and fine for you to keep doing it, as long as you look out for like that. Like the biggest thing for me is just that coning of the abdomen. Like I don't want my abs to stretch too much. And if something hurts, I'm not going to do it. But yeah, your body knows what you can and can't handle. Pain is there for a reason. It reminds you that you can't do it. So listen to it. Don't just push through it. But great. I think those are the biggest things.
That's great. Yeah. And just to touch on, so you had mentioned like the coning of the abdomen or any pain, discomfort, if there's any like increased pressure in the pelvic area, or obviously if there's things that you're very, very short of breath or dizzy, or if there's anything like that, like those are the times where rest, like there's no reason to push yourself more, even if it's like mentally you want to. Like those types of symptoms are the things that are like, nope, not worth it. There's a bigger picture, much bigger picture.
Agreed.
Awesome. Well, Ariel, I appreciate your time and just sharing about kind of your personal experience with pregnancy and with training and being an athlete, and as well as being a physical therapist as well. So really appreciate your time and just being able to jump on and share your insight with the listeners.
Yeah, no problem. Thanks for having me. This was great.
Thanks so much for listening to this episode of the Postpartum Performance Podcast. I appreciate you taking the time to listen, learn, and grow. If this is your first time tuning in, thank you so much for being here. The aim of this podcast is to provide oodles of the best possible content to help empower women, eliminate the phrase, I wish I would have known sooner around pelvic health, and to encourage personal growth through the postpartum journey to becoming the best version of yourself. If you enjoyed the show and found the content helpful, please remember to subscribe to the podcast and leave a 5-star review. These subscriptions and reviews help other mothers discover the podcast. If you're a regular listener, thank you. I encourage you to tell a friend about us or post on social media sharing your favorite part for today's show. If you're looking for more content like this, please follow me on Instagram at Postpartum Performance. Remember, mothers, if you're seeking to live life strong, I'm here with you in your corner. Continue to be brave, stay strong, and live confidently.